There's so much hope. You might see 5, 10, 15, 20 different practitioners who've all said, there's nothing that can be done. I don't know what else to do. This is just how you're going to be for life. Very unlikely to be the case. Usually you just need another way to look at it. It doesn't have to be me. It doesn't have to be Nancy. I mean, just there's going to be someone who can help you, and then someone else can help with the other thing.
Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. Hi, everybody. It's Dr. Nancy O'Hara, and welcome back to Demystifying PANS PANDAS. I am thrilled to welcome an amazing man to you. Many of you may know him, many of you may not. It's Dr. Josh Green. He's a naturopathic physician in Burlington, Vermont. Josh graduated from Bastyr for his undergrad with a focus in whole foods nutrition. I love him already. And from the Natural University of Natural Medicine in Portland, Oregon for his naturopathic degree. He's been lucky to be able to mentor with some wonderful people, Jared Jeff, Letitia Watros, and Christine Green. No relation, at least not known. They may not have done enough ancestry digging, but anyway, it's not as common as my maiden name, which was von Hufenfreuter. I know I'm related to all of them, but anyway, Dr. Green provides integrative primary and specialty care to patients, helping patients with chronic complex illnesses, including mold, mycotoxin disease, tick-borne diseases. He's a member of the Medical Academy of Pediatrics and Special Needs, the International Lyme and Associated Diseases Society, and he is ILADEF trained, which is part of the sister group to ILADS. And he's passionate about having an affordable membership-based practice where he accepts insurance for those who have it, some of whom are even on Medicaid. And he believes that affordable membership-based medical practices are the future of healthcare. Welcome, Josh. I'm really happy to have you on the podcast.
I'm so honored to be here. Thank you, Nancy.
Is there anything else you want to tell us about yourself besides that? And if not, tell us why you even became a naturopath.
So many ways to answer that question. It's a good one. I felt a strong yearning to understand more about what it was to be alive and what it was to be healthy. And, I had some of that knowledge from my parents, but it was this part and this part. And I felt like there was more to delve into. And my brother developed an autoimmune condition with about 6 months of his MMR vaccine. And so my dad and my stepmom go to the hospital, and they're sitting in a room, and there's like 6 other groups of parents, and all of their kids were within 6 months of their MMR vaccine, and they all had the same condition, which was called ITP. And that was my introduction to like, what could this be? And so, they went through the conventional medical, planning and thoughts and diagnoses, and basically we're told, well, we don't really know what to do. We could take your spleen out and maybe that would be helpful. Maybe it wouldn't. And so my stepmom found a naturopath, and he was able to help my brother. And he did mostly, I think it was neurofeedback, maybe some other things, but I think it's predominantly the neurofeedback or biofeedback. And fast forward my freshman year of college, I developed mononucleosis and got really sick, and I was working part-time as a kitchen helper. So I was trying to cut up some carrots and celery and onions. It was like the big thing of the day. It was like, 6 to 12 pounds each, and for the big
Wow.
banquets. And I couldn't even pick up the knife to cut a piece of celery. And I was like, what is going on? And So I went home, I had this major fever, and I said, "Okay, if I live throughout the night, I'm gonna go to the hospital." So I literally, like, hobbled and crawled to the hospital the next morning. I was at Michigan State University in East Lansing, Michigan, and I get there and they're like, "Well, we don't really know what to do for you. You might have meningitis, you might have mono," and I'm sick and I have no knowledge of medicine at this point. And I said, "Well," I said, "what are the symptoms of meningitis?" And they said, "Oh, you'd have really bad neck pain, you can't turn your head." And I was like, "I don't have that." And they're like, "Well, it's going around." And they're like, "We're gonna give you an IV of prednisone." And I was like, I was like, "No, you're not." I was like, "For what reason?" And they're like, "Well, there's a side effect that could suppress your immune system." I was like, "Yeah, no, like, I don't want to do that." And so I get home and my dad and stepmom pick me up and they're like, "We're gonna bring you to this naturopath." And truth be told, I'd like to be transparent in life as much as possible. And at that time, I saw a naturopath help my brother, and I thought it was really beautiful, and I was so thankful for him. But I really didn't like have a level of respect for the profession. I was brought up very, Western med, MD, doctor, everyone else is a little bit questionable. And so, I went there like looking at this guy. And also, mind you, I mean, he was a really sweet, kind human, good doc, but, in Michigan, not licensed to be naturopath. So he was limited in what he could do, so he had his desk and in like in the office and just shelves. All the walls were filled with shelves of supplements and had his desk in the middle. And I was like, this is just really strange. But he knew his stuff. So he took my hand and had me hold each of the like 10 bottles. He's like, "Okay, some of these 10 bottles will be good for you, some of them won't." So I held it to my chest and he did the muscle testing and he's like, "Okay, these are the 7 that you need to take." He's like, "Don't get up unless you go to the bathroom. That's it." So I listened to him and I was able to go back to school. I couldn't work, but go back to school and recover from the mono.
Yeah.
And it was that really hit me. And I was like, wow, like I don't want to have a desk in the middle of a room of supplements, but you know, that's interesting. And maybe there's a different way to go about it. So I contacted the school and said, this is fascinating. Does everyone practice this way? Like, I don't know if I really want to do muscle testing. And they're like, no, no, no.
Right.
You don't have to, there's lots of different ways to do it. And so I was kind of sold at that point. And yeah, that was the beginning of my delving into being a naturopath.
Well, and as you know, I have such respect for naturopathic doctors. And if
Thank you
I
so
had
much.
to do it all over again, that's what I would choose at this point in my life
Wow.
rather than an MD degree. And the main reason, I come from a family of 2 doctors. So, it was sort of a foregone conclusion that I was going into medicine, at least as far as my father was concerned. And I didn't get into integrative medicine until I went through 5 years of infertility.
Wow.
And I had a patient who saw my mentor, Dr. Sidney Baker, and recovered because of him. And so I went to him as a patient the
Wow.
first time. But I learned about integrative medicine still from an MD perspective. Now, the best MD in the book, when
Mm,
when you talk about Sid, there's not a more brilliant mind. But I didn't really start to learn about naturopathic medicine until I met David Brady, who
mm,
was at the time the provost at University of Bridgeport, and we were lecturing together in Vermont.
wow.
And, he said, "I'd really like you to lecture about this." And I'm like, okay. And I had to learn. And then I learned so much from all of our colleagues that are naturopaths that I was just glued to everything and going back and taking courses on everything. But it is the way our bodies are supposed to be treated. Now, I can't muscle test. I would never do that. I'm too left brain to even think about doing it. But there's so much to the integrative care, particularly of complex illness. Now, I'm not going to totally throw out allopathic medicine.
Right.
There are a lot of places with trauma and acute illness and all of that where it really has a role. But when you talk about complex chronic illnesses, integrative care is really the only way to go in my perspective. So what does that mean to you?
Uh, that's a great question. Can I? pause that for a quick second.
Yeah,
I had this thought. I can't help myself sometimes. So this is the ADHD brain coming out.
I got it.
So during I hope they still do this. I don't know, but during my naturopathic medical degree, at some point during the year, I think it's like in the winter, we had what's called the no talent show. So you were encouraged to participate whether or not you had talent, right? That was the just by the
Yep.
name. And one of the things that happened most years that I was there, but not every year, was the total spoof, laughing at ourselves, not real, naturopathic ER. It was so great. So,
Love
patient
that.
patient, like, hobbling in, and they're like, I just had someone hack my leg with a machete," and then the naturopath comes over, and, they're, like, burning incense, and they're like they're like, "Oh, your chakras are a little bit out of line," and they're like, "When was the last time you, really meditated, in the full moonlight?" And it was just like
Yep, yep, it
it was
is
great.
so
It
true.
was so
Yep.
great. Yeah, I so back to your question, I love integrative medicine and, part of the ironic history similar to me becoming a naturopath and not at all, thinking highly of the profession in the beginning, hilariously, when I became a naturopathic medical student, I was vegan at the time. I had dreadlocks down to my last rib, and please laugh at me. You're encouraged. I only wanted to treat people who were vegan or vegetarian. I didn't want to use anything other than diet, homeopathy, walking around barefoot, and maybe herbs on like intense occasions. But even that was a little too forceful. And I was really against spinal manipulation, right? Let alone, surgery and pharmaceuticals and all that. And
And believe me, if all of us were vegan and could walk around with no shoes and living life homeopathically and with a few herbs, we'd all be a lot healthier.
maybe
But
even for just the parasites that we would get that would keep our immune system,
exactly,
in check. Yeah, yeah.
exactly.
So it was, my 4th year of naturopathic medical school, I started to what's the right word? Like, see some of the benefits of integrative medicine, right? I mean, in naturopathic medical studies are integrative by definition. It's like rammed into your brain every possible way that you can. It's what our degree is based on. But I was not into it. I was still like fighting for my little corner of this is how I want to practice. Like I'll learn that, but that's not how I want to practice. And it was the last year that I started to really see things in a different light. And it was really, actually the short story there is so my family's chiropractor did this certain version of chiropractic. I think it was called straight chiropractic, and it was like this particular kind where you only adjusted the atlas and the axis, nothing else.
Yep.
And so I went to see her once, and she said, "Oh, have you been doing your angel wing? Actually, you lie on the ground and you move your feet like a kid in the snow." She's like, "You need to do 15 every day for 10 days before you came to see me. Did you do that?" And I was like, "No." I was like, I've been in medical school." She's like, "Out." And I said, "But I'm here from Portland." And she's like, "Nope, I'm not treating you. That you need to do." And like I had a headache like constantly, 24 hours a day for like months at that point. It was really debilitating. And like seeing that dogmatic intensity really kind of like hit me. And I was like, "Oh, like I don't want to practice like that." And then I started
Yeah.
to look at things a little
Interesting.
differently. And that's when I started to open up a little bit more to other things. And by the time I graduated, I was like, wow, I love doing spinal manipulation, and
Mm.
I think I'm going to use herbs. And then I spent 3 years practicing in Ithaca, New York. I moved there partly because I have a friend who has a herbal school there. Seven Song has this awesome, wonderful herbal school program. And so I moved there. The word on the street was that New York was going to get licensed like within the year. This was 2000 and when I graduated. By the way, it's 2025. They're still not
Still
licensed.
not.
So I was
Yep.
there for 3 years, unable to order labs, unable to check blood pressure, listen to the heart and lungs, take insurance, anything. And so all of my patients, had an MD, DO, NP, PA, who was like their main person, and I was this, nice idea consultation. And, after 3 years of doing that, I realized how important being a primary care provider was, being that
Yeah.
central hub of saying, for you, I recommend you see this PT, or for you, I want you to see this acupuncturist, or, we're really going to order labs from this place and not this place because of X, Y, or Z. And I saw the power in
Right.
that position to really affect change. And I went to my friend Shannon's wedding. She got married in Temecula, and I was sitting across the table from another naturopath, and my friend Gabriel was like telling me how great Vermont was, and then he was talking about helping patients with Medicaid, and how nice that was to be able to help people with Medicaid. And I just lit up, and I was like, I want to do that. And he looked at me and he was like, it pays for crap. Are you sure you want to do that? And I said, getting paid for crap is better than what I'm getting paid in New York, because, I was waiting tables on the side of my naturopathic
Wow.
degree. I was baling hay. I was helping do back wall for a stonemason. Like, I mean, I couldn't pay my bills with my profession. And, I was like, I will happily take anything that I can. And so, yeah, that was the beginning of becoming a primary care naturopath. And then one of my mentors, Dr. Zeff, and Dr. Watras, they both are very focused on complex illness. And so when I set up shop, that's the patients I was attracting. And I had a patient who came to see me, and they were like, yeah, I think I have Lyme. And, this is also one of those like hide your tail between your legs kind of like, to life. And I said, oh no, chronic Lyme there's no such thing. And I even joked to them. I disagree with the CDC a lot, but that's one of the things that I actually agree with them on. And I said, but who knows? Maybe I'll change my mind. And so I'd worked with this patient for, I don't know, a few months, maybe a year. And the rapport was good, but they clearly knew what they had. And so they found one of my colleagues, Dr. Alexis Chesney, and saw her, and she diagnosed them properly. And then that patient came back. It was really sweet. And they said, I can tell that you really care about helping people, and you're very compassionate. And, I don't know how to say this. You were dead wrong about chronic Lyme, and you really need to get properly educated. And he said it a little nicer than that, but I was like, wow. So I called up Alexis that day, sent her an email and said, hey, can we talk? And I think she made time for me that day or the next day. And I said, I need to do this. How do I do this? And she said, well, go to iLads. And I said, okay. I said, I don't really want to be a Lyme doctor. She just laughed. She's like, you're just going there for the weekend. No one's going to like make you be a Lyme doctor. And I was like, okay. I was like, can I still just send my patients to you? I promise to go. She goes, that's fine. I will take your patients that you send to me. She's like, but you might want to do this. And I was like, no, I'm not gonna, no. So I went the first year, and then I didn't go the next year, but I've been every year since.
Wow. And what was the first year you went?
2015.
Wow. Yeah. I mean, and as you know, and as many of the listeners know, I mean, I think herbal medicine, naturopathic medicine does a much better job of treating particularly chronic tick-borne diseases than allopathic medicine does. I mean, all we do is kill, and it requires so much more than that.
So much more. Yeah,
Yeah.
so much more.
Yeah. And that, I mean, and integrative care, I mean, I think what both of us are talking about is not just herbs, but all of the things that we need to be healthier, the grounding, the natural biohacking, the vagal nerve stimulation, the diet that may not be vegan, but can still be healthy, right? You've allowed that. We don't all have to be vegan. You'll take a few of us pescatarians.
Just a few. Yeah, I have
Okay.
a quota. Yeah.
A token. A
Yeah.
token. All right. Got it. Got it.
Otherwise, I couldn't even have the practice myself, because I'm not vegan anymore.
Okay. Got it. Got it. Got it. But do you agree? I mean, integrative versus allopathic in chronic illness, tick-borne disease or not?
Yeah, 100%. I have patients who are on disability, Medicaid and Medicare, and they can't afford anything beyond what their, Medicaid will cover. Um, that being said, I have to tell them, like, you know, if there's only because I can get probiotics through Medicaid, it's
Right.
great. But there's one thing that it won't cover, and that's the enzymes to break down the biofilm. And so I do say, look,
Ah,
like, we need to wait until we can save up so that you have 4 months worth of at least the Cerediya. I've been known to, you know, get that to them at more affordable ways as
yeah,
well. But like that for me is like the base. We can do all prescription meds with the, enzymes like, Cerediya or lumbrokinase or nattokinase, and a probiotic. But really, the other part is the lifestyle. Like they need to
yeah,
be sleeping, they need to be resting, they need to be moving, and
yeah,
taking care of their body and not eating, so that was another challenge was with that patient was that, their diet was very, very limited on mostly food shelf,
yeah.
So but it was, I mean, they were so dedicated. It was really wonderful. And so, and I have patients on the other end who were like, I have to do the opposite, and say, you don't need all these things, like, and it reminds me of there's a saying for the job of a good rabbi, and rabbi in Hebrew means teacher. It's like it's
Right,
turned into like a job, but it was never a job. Like in the olden days that I was not alive during, rabbi just meant a teacher. You could be for
right.
anything. So the job of a good rabbi is to comfort the afflicted and to afflict the comfortable.
Interesting.
Yeah,
Afflict the comfortable. I like that.
right?
Yeah,
So I use that in other ways too. It's like in some patients I really have to, educate them. And as a former teacher, I know, well, not, I mean, we're all still teachers as doctors, especially, but
right. I mean, that's the derivation of doctor too, is teacher, right?
totally right.
Yeah,
So, we have to educate them on the importance of taking certain things or the importance of avoiding certain things. For my tick-borne illness patients, I really hammer home the importance of getting that intracellular pH to be a little higher than the average so that we're getting more basic, eat more vegetables,
yeah,
more beans, less animal foods, moderate on the grains, minimal gluten to no gluten. And then for the mold patients, for me, like I've whittled it down to three or four things that are like the most important, and that's no corn tortilla chips, no moldy coffee. You can get coffee that's not moldy, no sugar cane, and there's something else I'm forgetting right now. I'm trying to think what it is. The peanut products because of the aspergillus, the aflatoxin.
interesting. Yep, yep,
Yeah.
yep. Okay.
So yeah, the diet part is so huge. And
Yeah,
I've had patients where you do all the things, but they're not changing their diet or they're still smoking, 10, 12 cigarettes a day and they're not moving and they doesn't matter how many things you pump into their body by pill or any,
right.
like it's not going to work.
Right.
Yeah.
Exactly. And it becomes a little bit complicated. And PANS and PANDAS, the P is pediatric. And as a pediatrician, I don't like adults. You know that. You were one of the few I tolerate. But anyway,
Thank you.
but in kids, RFID, the restrictive eating disorder, is in at least 20% of kids with PANS and PANDAS, and up to, I think it's more like 35% now. How do
Wow.
you deal with that in your practice? Because I know how I deal with it. But how do you help them when they have a restrictive eating disorder and are only eating that crap?
Yeah.
I know how to get it started from the beginning, but how do you help them in the kids or even worse, the teens?
Yeah. So I was so tempted to say something sarcastic, like, other than shaming them and yelling at them and
Yeah, exactly. Pinning them down, force feeding them. Yeah, what works for you? Yeah,
exactly. So thankfully, I have my undergrad is in, has a focus in whole foods
yeah,
nutrition. And so, I had a one of my professors, I'll never forget, her name was Beverly Kinblade, and she's from the South. She had this wonderful accent. I could hear her talk about anything. And so she had experience working in hospitals and, as part of her dietetic internship. And she said to us, because this is Bastyr. So, like, it's kind of like, as granola as a nutrition program is going to get. And some people were there for the dietetic focus and some were just there like me for the nutrition. So she said, if you can focus on a certain part of getting people to change, it's get them to add something.
Yeah.
If you want people to fail, have them subtract something.
That's so true.
Yeah. And
I
so she
love
said,
that.
yeah, one of her tricks was, have someone eat 5 or 10 almonds a day. Don't tell them to not have their potato chips.
Yep.
Tell them to eat 10 almonds a day. And so I've incorporated that. I'll say, all right, we're not going to talk about changing anything. I've already told you why you might not want to have certain foods, but I'm going to be very transparent with you. Before you have your potato chips, before you have your slice of pizza, whatever it is, I want you to have 10 almonds, or I want you to have a quarter cup of hummus, or
Yep.
whatever it is that's like missing, right?
Yep.
And I said, spoiler alert, you're probably going to have a little bit less of those things. And that's my intention. But if I tell you not to have those things, it's going to backfire. So I want you to
Yep.
continue with the mindset of having those things, but just focus on having these first. And that's worked really well.
Yeah, that's great advice. And it's something I do intuitively also, in that, one of the things I think a lot of our kids are missing is protein. They
Mm,
have a very carb
yeah.
laden diet. So I'm not
Yeah.
trying to take away the carbs.
Right.
I'm trying to add a protein.
Right.
And I just go through all the proteins that they'll do. And, I'll allow a steak.
Right.
Because that'll get a protein in,
Yep.
before we can get the almonds or the hummus or whatever. But once they
Right.
start adding, and I think that's so important. And moms are always like, I can't get them off this. I can't get them off this. I'm like, we're not going to try to do that right now.
Right.
It may happen naturally as we
Yep.
add these other better things. That's such good advice. I'm
Yep.
glad she was easy to listen to so that
Uh,
you could hear it that way.
He was great. Yeah. And
Yeah.
the other thing that I like to do, which I know you'll get, I know you, I just know you enough that I know you do this, is I talk to the kid like
Yeah.
directly. In fact, for the majority of the visit, the majority of the time, I am talking to the kid so that the parent can hear me,
Yep.
but I'm talking to that kid. And, you know, I think compliance is just so much better because I remember being a kid at the doctor's office and it was the opposite. I was like, I was the patient, but I could have been a fly on the wall. I
Right.
mean, so
Yeah,
yeah,
anything I have to talk to the parents about, like sometimes, patients are waiting a long time to see me and they've been through the ringer and, the kid is 5 years out from their initial, but they've got to tell me about it. I let
right.
the parents get all that out while the kid's in the other room playing.
100%.
And then
Yeah.
once the kid comes in,
Yep.
it's all about the kid. And it's all about, and I even will do contracts, especially with teenagers. Okay, I just want you to do this. We're going to shake on it. You're going to do this between now and the next time I talk to your mom. That's all I'm asking. It's not forever, just now. Will
Yeah.
you agree to that? But we're shaking on it. I'm being totally transparent with you and all of that. I'll even take a supplement away that, if they'll agree to do this in the diet, we'll negotiate,
Yeah.
and I think that really helps.
Yeah. No,
Yeah.
absolutely. Yeah, it does. And I'll also say to them, I'm going to give you a list of things that I would love for you to do. And we're also going to talk about the like most important things.
Yep.
And all I ask is between now and the next visit, this is, the beginning, kind of getting used to
Yeah.
each other. I'll say, all I'm asking is that you just at least try it. At
Yeah.
least try gluten-free noodles once. And if they're gross, let me know and we can figure something else out. Or, try some hummus or try some beans or, you know, try some kale chips. Like if you don't
Yeah.
like vegetables, like, what about celery or carrots and ranch? And often the kid will be like, well, wait, I can dip it in stuff. And I was like, I
Yeah.
don't care what you dip it in. I just want you to have 2 carrots a day. And they're like, I can do that. I'm
Yeah,
like, awesome.
exactly. Yeah, and it's just that getting them started, that
Right.
getting those good things in, like the gluten-free noodles. I mean, a lot of kids, when they start eating them, they're like, "Oh, this isn't that much different." And as
Right.
somebody with celiac, I can tell them all the best gluten-free products to buy and
Yep.
how long to cook it for, because that's the biggest mistake a lot of moms and dads
Yeah.
that make is they'll cook the gluten-free noodles as long as everything else, and then it
Mush.
comes out like glue. Yeah, it's gross,
It's
but
gross.
it really is gross. But anyway, so you talk a lot about having a relationship with your clients, and I know you do, and I know you as a person, but why did you decide to offer a membership-based clinic? What's that about and why?
So I was at the point where I started to dream about being a mailman in a male person in Ireland or somewhere in Europe. Like I loved my job, but it was exhausting. So,
Yeah.
I was seeing somewhere, depending on the day, somewhere between 11 to 17 patients a day as a naturopath, spending, most of those visits were 30 minutes, maybe 45. Some were only 5 or 10 because they were just a quick throat swab and, whatnot. But yeah, they were big, big days, working all day. And it just got exhausting. And I look back on why I became a naturopathic
Yeah.
physician, and I was like, this is not like, yes, I'm getting to help a lot of people, but I'm not really giving them the service that I want. And, Vermont, like, yes, there are people here who have lots of money, but in general, there's a lot of folks who are just, working class. It's it I could just see, there you could totally have a concierge practice in Vermont and, maybe have, I don't know, what, 20 patients and they would each pay you $1,000, whatever the math is on that. But it's not my style.
Right.
So I said, okay, how how can I make this work so I'm being authentic to myself, and treating the patients in a way that makes sense, to them and to me. And so it wasn't concierge, which, if that works for people, great. The fee for service thing, one, like, most people in New England are very, I mean, you probably know this too. You're in New England, very like, well, I have my insurance. Like, I want to be able to use it,
Right.
and I get that. And so I didn't want to do pure insurance anymore because I was pretty much at that time like 80% insurance. And I didn't want to do concierge. And so yeah, the membership allowed me to give better focus to the people that I was working with. And so at the time, I had about 2,000 active patients over a 2-year period, and I would spend 2 to 4 hours every night doing admin, doing script refills, replying to emails. And, it was just like I was burnt. Like,
Yeah.
okay, yes, I was watching Iron Chef while I was doing it, and so that made it fun, or Harry Potter. And, I was, sitting next to my partner and sometimes, we would play footsie and, because they were doing that too. But like, it was still exhausting. And I was like, I
Yeah.
feel like I'm being robbed of my life. And so that was the big push. And so, it's not perfect, but I now have, so I had, over just over 2,000, and now I have under 200, and I'm able
Wow.
to spend more time with them, virtually get them in the day of if they need to see me. There are some exceptions, like the hilarious patient who contacts you and they're like, I really need to see Dr. Green today. And my manager is like, okay, well, he can. So I have 15-minute slots between every patient now. So I can, do admin or
Yeah.
respond to this or that. And oftentimes I'm still running late for the next patient because I spend so much more time with each patient because I also like to know who they are and just
Yeah.
ask them about non-medical things like, how's your job? Have you been going anywhere fun lately? Or, make any
Yeah.
fun food or whatever. So yeah, so I got sidetracked. What was so that the
So
15 minutes. So some
yeah.
patients, they'll say, oh, well, yeah, no, I can only do this time. They'll literally like one time. And they're like, So and my office manager is like giving them like 4 separate times that so clearly it's not an urgent matter, So and I had patients who were like, I'll take whatever he has.
Exactly.
So with the exception of the I can only be seen at the time that I want, I'm able to get everyone in that day with
Yep.
multiple and sometimes as long as it's not a patient who's, you know, uh being a little more like, oh, I only want the time I want. Like I will see patients like at 6 or 8 p.m. I'll do a telemedicine, but I try not to do that because I don't want them to think that that's like the norm.
Yeah.
Like I didn't do concierge for a reason. Like,
Right. Right.
but I do make exceptions because sometimes patients have jobs where they can't take time off of work. And I
Right.
know that I know that their job won't let them, or they just got a job and they can't for
Right.
6 months or something. So and I love to be able to do that, to be the doctor that I would wanna see.
I hope when I grow up to have a practice like yours.
You were so kind.
No, I think, and you actually say that you think that this could be the future of medicine, because I think what medicine is really missing is that time, that really listening. And it
Yeah,
was one of the things Sid taught me, if you listen, they will come.
yeah,
And when you're seeing, 40 patients a day, 20 patients a day, however many you're seeing, you can't provide that listening ear
yeah.
physically yourself, mentally, certainly, and then not, to mention the time warp and all of that kind of stuff.
It's
But
so true.
why do you think it should be or could be the future of medicine? The membership-based model.
So, we had and I could be wrong, so please interject, but, like, I think at this time we have unprecedented decreases in people being interested in going into medicine,
Yeah.
unprecedented decreases in people going into primary care, and furthermore, mind you, it's going when I say it's getting worse, right? Medicine, primary care, and then family medicine is even like the worst.
Yeah.
So, like, as far as people being interested, less and less people being interested because, I read some study, they said, you know, family medicine doctors or primary care, it's either family medicine or primary care, one of the two, have not seen a real wage increase like since the 80s or something. It's like
Right. The
crazy.
cost of living, it doesn't match.
Right.
Yeah.
Right. And so I think this is one of the easiest ways. Like, you know, I don't I don't put too much thought on the likelihood that we're gonna get a medical revolution to happen by petitioning our Congress to an executive branch to make these changes. Like, if it does, great. But I'm just saying I think the best way is to just accept what's there and then just work with it is for
Mm.
me the easiest way. And so I would love for things to change. I would happily give my time and energy to get that to change. I'm not saying I wouldn't, right? But like walking around with like protest signs or sending letters, like, like how much is that going to change? And
Yeah.
maybe I'm cynical, but if we, if we can give better care to people,
Yeah.
and then they tell other people, I think we'll see less doctor. Oh, I almost forgot. More doctors retiring early,
Oh, yeah.
right? So if
Especially since COVID.
right, totally.
Yeah.
So if we can reinvigorate people's joy of being a doctor and
Yeah.
joy of being a patient, I think
Yeah.
I think we'll get people back into wanting to be a doctor.
Yeah. And they're not mutually exclusive.
Right.
I mean, us feeling better
Right.
helps them feel better. Them feeling better helps us feel better. And we can't
Yeah.
do that if we're doing too short of visits and protocoling people. That's the other thing that drives me mad,
Right.
or, that one size fits all, which takes me all the way back to, sort of what you were saying with your brother, well, at the time, the treatment for ITP is getting your spleen out. Well, whoa, 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 whoa. This is a kid we're talking about. And, well, the MMR can't cause that. Well,
Right.
we're not saying it causes it, but
Right.
but there's a correlation here. There's
Right.
6 people waiting in your waiting room, and all 6 of them had the same thing.
Right.
What else could we be looking at? And maybe if we allow that in more of our practitioners,
Right.
all of them, it's got
Yeah.
to be in the nurse practitioners, the PAs, the MDs, the DOs, and the naturopaths.
Yeah.
We all, and not to exclude others,
Right.
that are
Yeah.
great clinicians too. I just
Right.
mentioned a few.
Right.
Just trying to be politically correct. But anyway, it really could change things.
Yeah. Yeah. Absolutely. Fingers crossed it does, because the other way, excluding, shaming, using power to like shut things down, like that doesn't feel good for anyone. It doesn't
Right.
it doesn't help anyone,
Right.
and yes, correlation is not causation. And at the same time, what's the problem with looking at correlation and saying, well, what other aspects to this are we missing, right? And for
Right.
me, that's scientific,
Exactly.
and
And
yeah,
individualistic.
and individualistic. Yeah.
And what I think is missing these days in the doctor patient relationship, at least in allopathic medicine, is that individual. I know what's good for the public health. I know, but I'm looking at this individual child in front of me, and I've got to learn everything that could be causing or correlated with their illness right now.
Yeah.
And in doing that, then I can come up with a program, whether it be supplements, medications, diet, lifestyle, all of that together that works for that kid. But if I'm under the constraints of, well, everybody has to do this, that may not work for that child with autoimmune disease.
100%. Yeah,
Yeah.
100%. Yeah, I love that we are getting more into individualized medicine. That's just great. I'm really glad to see this movement, and to see how many doctors are becoming functional medicine and becoming more integrative. It's awesome. It's the future. And it's very historical, right? We had the Flexner report back in the, what was it, 20s or 30s or whatever, and the like squashing down of anything other than allopathic mindset, and now it's like this resurgence, and it it's awesome. Like I'm so honored and glad to have colleagues from different degree programs, and we're all working together and trying to become more like each other. Like
Yeah.
I love that, and that's one of my dreams for medicine is for all of us. It is in a way going back to pre-Flexner report differently, obviously, but like where back in that day, as far as I understand, you went to an MD program, but how you practice was up to you. You could use primarily herbs, you could do homeopathy, you could do allopathic, you could do a mix. There were all these different kinds of practitioners, but they all had an MD. So for me, as much as I love being a naturopath, and that non-ego pride of just, you know, the history and being a part of this, in a heartbeat, I would throw it away if we could all come together
Yeah.
under one degree, all have the same kind of foundation, and then we just would go I think maybe I'm being a little hopeful or delusional, but like, I think that there's a greater chance that we would have more ability to work together,
Yeah.
you
Yeah.
know?
And that's a beautiful thing. We have so much to learn from each other, and our
Yeah.
patients could really profit too. But if
Right.
you had a magic wand besides the membership, would
Yeah.
there be one or two other things you would change besides what we've already talked about, or have we touched on everything
Uh,
about healthcare in general?
no way we could even get close to touching that. I would love healthcare for all. I really would
Yeah.
love healthcare for all. And I think really it's in the best interest of the private insurance as well. I think there's this misunderstanding, maybe even delusional mindset of looking at things, and I don't mean that in a shaming way, but like, there's this like, oh, you're into healthcare for all, you're pro-communist or pro-socialist, or you hate private insurance companies. No, not at all. I'm saying let's call a spade and focus on what makes sense for who is applying it. I'm a naturopath. I am not going to be in an ICU trying to deal with someone who got hit by a semi truck on their bicycle, right?
Right.
Nor should an emergency medicine doctor try to start doing homeopathy and herbal medicine and nutrition without getting properly trained in those things before they
Right.
do it, right?
Right.
Like, know your territory and your education and all these things. And so similarly, we have private insurance companies that are running healthcare for folks where I think where they really excel is the upper tier. So like, let the base get covered by government, which is like public health, so everyone has access to getting a stitch if they get cut. Maybe it's not the best stitch that's ever happened in the state of wherever you live, but you're going to get stitched. You're going to get attended to. You're going to get medicines. And, you need to talk to someone about your reflux. Well, maybe it's not the best reflux doctor in the state, but you're getting to be seen. And if you want that extra tier, if you want to see that person who has a special certification or fellowship in, something really cool, you can pay out of pocket for it, or your
Right.
insurance can cover those things like, you know, acupuncture or, zero balancing, or
Right.
private insurance can cover the extra stuff and the government can cover the base. Because I think the problem is that the private companies are kind of by nature trying to make a profit, right? And I don't want to get in the way of them making a profit, but their profit gets in the way of providing public health.
Yeah.
So it's like, why not just
Yeah.
split, you
It's
know?
so fascinating. My dad, way back in the 90s, worked for the public health department rather than going to war. And his job was to find how to change our healthcare system. And basically, the report he gave was exactly what you're saying. Exactly what you're saying. And of
Wow.
course, nothing came of it. And, we're still talking about it. But the other thing along with that is that I personally feel we don't have a health care system. We have a disease maintenance system or a
Right.
disease care system. We need that group, which in my opinion can be more integrative physicians, lifestyle management physicians, practitioners in general that can help people be healthier
Yeah.
rather than just the disease treatment.
Yeah. Absolutely. I mean, yeah, that magic wand, like part of that would be, I think integrative doctors, whatever your degree is, doesn't matter. Integrative practitioners, I should say, but primary care integrative practitioners, that should be primary care. Primary care
Yeah.
should be primarily integrative practitioners. And then you can go out to the different specialists. I think
Right.
I think that would be.
Yeah, and it would rejuvenate at least a lot of the primary care,
Yeah.
family practice,
Yeah.
people that really are good at that, but are
Yeah.
abandoning it, either retiring or not going into it because of the heavy workload and no pay.
Right.
Um,
Yeah.
so yeah. Oh, Josh, I could talk to you for hours and hours and hours
Same.
about this, and
It's such
we
a
may
joy.
have to do more of it offline. But
I
as
would
far
love
as
that.
the podcast goes, first of all, tell people how they can reach out to you, how they can find you.
So, yeah, if you Google my name, Joshua Green, ND, Burlington, Vermont, that'll pop up. My website is vtnfm.com, or you could spell it out, Vermont Natural Family Medicine.com.
And any last words of wisdom, of advice, of hope that you want to leave families with that are dealing with complex chronic illness?
There is hope. There's so much hope. And, I know it's frustrating. I know it's really frustrating because you might see 5, 10, 15, 20 different practitioners who've all said, there's nothing that can be done. I don't know what else to do. This is just how you're going to be for life. Very unlikely to be the case. It's usually just you just need another way to look at it. It doesn't have to be me. It doesn't have to be Nancy. I mean, just there's going to be someone who can help you, even if it's just getting a few more steps before with that help. And then someone else can help with the the other thing. And, one of my professors is great, MD turned wildlife biologist turned MD turned homeopath. He said, sometimes, but rarely, you're at the defense line of your soccer field and you kick the ball and it goes right into the goal. That happens pretty rarely. He said most of the time, you kick it 10 yards, someone else kicks it, and you get a goal, you
Yeah.
know, and it's a team effort and it doesn't mean that you didn't do a good job, So I think if you're suffering, there's going to be someone who's going to help you further down the road and then further down the road. And then eventually you'll get to the goal line. Just don't give up.
Yeah. Yeah. Don't give up. It takes a
Yeah.
village.
It takes a village. Yeah.
Yeah. Well, Josh, thank you. I so appreciate
Uh,
all that you do,
Thank
the
you
person
so
that
much.
you are,
Mutual.
and
Mutual.
come back next time for Demystifying PANS Pandas. Thanks, everybody. That's it for today's episode of Demystifying PANS Pandas. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANS Pandas.